This short video will be looking into assessment of adductor related groin pain. It's a condition which we see most weeks in our clinic, extremely common in rotational sport, a little bit more prevalent in male patient than female. So we've got a patient here, Martin, who's coming with long-standing adductor pain. So he's complaining of pain on his left adductors. So we're going to go through some of the key tests I use to confirm the diagnosis. So I'll be using a combination of strength testing and also stretch and also palpation. So Martin, if you could lie on your back, please. So we're going to look into strength testing. So it's really important to test this muscle in different ranges. So we're going to start with short lever. So if you lie on your back, please, and bend both the legs. So we're going to start with a short lever. So somebody who is highly irritable, I'm going to just use my fist here. Can you give a squeeze? Push, 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 push. Hold it, and then relax. So looking for two things. I'm looking for pain and I'm looking for weakness. So if the patient says it reproduces their pain, so it's really important with all these tests that you ask the patient, is it really their pain? So I'll say yes, when I'm squeezing, is it reproducing their pain? Now you get a bigger patient where they might need more force. What you might do here is try to use your whole forearm. So I might just block it here, use my body weight here. Now push, 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 looking at the patient and seeing whether that reproduces the pain. So that's the short lever. Some patients might not get any pain in this short lever position. So you might want to test it again in the long lever. Exactly the same procedure, but in the long lever position. Now if you push against my hand, Martin, push, 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 and then stop, relax. Now again, in the using a forearm, especially if you think you need to generate more force, push, 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 push. So I try to hold it for at least 4 to 5 seconds. So again, looking for pain and weakness. So we tested the patient both in the short as well as long. Very rarely you'll get patient where they say, I only get pain when I reach for a ball in outer range. So you might want to look them into outer range. And this position is always useful to also see their length. So what I'm going to do here is block the leg over here, so that sort of I don't need a second person. Take it to the end range over here, just go in and just block from the top and just push. Now Martin, push, 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 push. So what I'm looking is checking the strength of the adductors in the outer range, and again looking for pain reproduction. So there are 3 different ways by which you could look for provocation test: short lever, long lever, and an outer range. Could you bring the leg back, please? And while you're here, it makes sense to also look into the location of pain. So commonly you might have pain in the myotonius junction. Sometimes you might have pain all the way across the bone. The most common affected muscle, up to 70% of the injuries tend to happen in adductor longus, and sometimes you can also have avulsion. So while you're in this position, I might give some mild resistance. So Martin, push, push, and then I might going to palpate exactly where the pain is. So is it more on the myotonius junction, or is it more towards the origin of bang on the pubic bone? So it has huge implications in your rehab. If the injury is more myotonius towards the muscle component, the rehab might be quicker. It might be a few weeks, 4, 6, 8 weeks. If it's more towards your bone, it could take 3 months, 4 months. So the more towards the tendon, obviously it's going to take longer, because we know tendon rehab takes longer. So that's sort of a quick screen to look into diagnosis of adductor related groin pain, extremely common in rotational sports, and also helps you to facilitate the location. So strength testing, stretch, and definitely palpation. You must be able to reproduce the pain on palpation, and then once you've made the diagnosis, you might go through a step-by-step process of the rehabilitation, getting them back from isometrics and building them all the way to return to sport. Thank you, and hope you found the video useful.